As you can imagine, we are also doing a bit of public education here tonight. Very often in Geneva community, we get the question, how do you work together in the UN family? Are you really working together? So in order to reassure you, we'd like to introduce another perspective on risk reduction, which is from the health perspective. Dr. Eric Laroche is here from WHO, and I think he will support me in my claim that primary health care and risk reduction is the same thing. Eric, please. Please. As you can hear, he didn't say yes. Please.
Thank you, Margareta. Good evening, Excellencies and ladies and gentlemen. After all these speeches, I was really wondering what should I say, which makes sense. And I think there's at least a good news. The good news is the fact that the Director General has, with some of their regional directors of WHO, have pushed the idea of having a special resolution next year at the World Health Assembly on preparedness, disaster risk reduction. This is extremely important, because it means that all member states of WHO, which is 193 member states, are going to adopt a resolution that is going to lead us to better preparedness, better contingency planning, better disaster risk reduction. So what does disaster risk reduction mean for us? I think last year we launched something which was called the Safe Hospital Initiative. It means that the worst place that you would like to die in that has nothing to do with your own disease or trauma is a hospital. A hospital is a place where you feel like protected, at least, by the staff, by the structure, by the quality of care. And you don't want to be killed because the ceiling is falling onto you. Surely not. You may accept to be killed because of your own ill health. And this is what is happening. This is what has happened in one of the most developed countries in the world. Is that something that we want to continue doing? Is this acceptable? Are we accountable for? For how long are we accountable? And those are the real questions. And I would like to talk a little bit about that. The first, I think, challenge for us is partnership. And partnership means we have to work together. But who are the together? And in that respect, it is not exactly what we used to be doing in health. In health, we used to work among health professionals. But in public health, we have to use with urban planners, we have to use with architects, we have to use with schools for health. And those are constituencies that very often are quite extreme compared to our own small focus. And therefore, we have to bring them together. And I would like to emphasize the fact that you have to bring them together where the problems are. And very often the problems are not at the national level, they are just at the local level. And this is where we have to work. I spent 4 years in Bangladesh, and I spent 4 years, in fact, in Myanmar too. And I was amazed to see that it cost $500,000 deaths of people in Bangladesh to see the people reacting and putting their act together at the village level to save their life and to prevent further disaster consequences. When we were in Myanmar, we had to call Bangladeshi people, their neighbors, to come to help them building back and putting the systems in place at the community level. And that's, should it take a disaster for us to react, for us to be able to get prepared? Surely not. It should not do that. But it's always like this. Unless you get sick and you recover, then you realize that you could have prevented to be sick. And it's the same thing with disasters. And one of the reasons has been highlighted previously, saying that we need to get results in 5 years' time, because very often we are elected for 5 years and we don't have the chance to make any difference in 5 years. But therefore, we have to have the courage. I think the resolution that is going to be passed next year, I hope so, is going to help everyone, countries being rich or not, to face this tremendous challenge. And I'm saying rich or not, because in fact some of the poorest countries in the world are best prepared than many of the developed countries and rich countries. So it's not really a matter of money. It is a matter of commitment, particularly at the municipality level as far as health is concerned, as municipality level and community level, extremely important. I was wondering whether anyone from Kathmandu, the mayor of Kathmandu, or Bishkek or I don't know, Bandung in Indonesia, have gone to Haiti. I wonder whether, whether in humanitarian action we do learn lessons. And I think the best way to learn lessons is just after the disaster starts. All of us who have been in a disaster-prone country, seeing people dying, seeing people that have been, families that have been completely struck by the death of their own members, we are marked for the entire life. And I think a mayor that would go to Haiti just after the earthquake would not come back the same man and as the same manager as it would be if we would come from, as I say, these different time bomb cities. There are cities, we know where it's going to happen. The only thing we don't know is when it's going to happen. But we know that if we don't act together right away, we're going to be responsible for the death of thousands or hundreds of thousands of people. And that, to me, it poses a major problem, because I haven't had the gut to take the Minister of Health from Kathmandu, for example, into Haiti. But I went myself to Haiti, and I haven't even reported to the Ministry of Health of Kathmandu, and I should have done that. We should have all done that, I think. The problem is to get prepared now. And the paradox is none of the donors want to invest in preparedness. They will all want to invest. In fact, we even get sometimes too much money in response, and too much money is poured in response instead of being invested properly in preparedness, contingency planning, and so on and so forth. And I think we need to be able to create a movement, and I think there's some sort of recognition that nowadays we should not spend a dollar in a given country for response unless we also invest in preparedness for the next time. And what does preparedness for the next time mean? Building capacity. Building capacity and building capacity. I was a few weeks ago in Pakistan. I know Pakistan well because I've been also staying in Pakistan. What struck me in Pakistan is the difference between the north and the south, the difference between the way the floods has been handled in health in the north has been handled in health in the south. Huge difference. And the difference comes from the fact that in the north they have had to deal with earthquake, floods also, war, and therefore they are much more prepared to respond to emergency. And I think the number of deaths in the north definitely, even in hospital, is much less because the quality of care is much better because all these disasters that have occurred before. The best place to be treated and if you want to be sure not to die if you have a cholera case, is not in Paris, surely not. Probably not in Geneva, maybe, but it is in Bangladesh, in the IDDR2010, the hospital for cholera. In that hospital, no one dies from cholera. Why? Because they have learned the hard way how to be prepared to respond to the consequences of a disaster. I want to say something which probably is not very politically correct, but I've been spending more than 25 years in the UN system and in the field and with the humanitarian community. And I must say there's a sort of arrogance. Surely there's not enough respect from the part of the humanitarian worker that works on the response, for those people that work on preparedness and disaster risk reduction. This has to change. Has to change in the budget, has to change in the profile of the people that are working in emergencies. And this is not as yet the case. There's a move, there's a change in the last 5-10 years, but we are not there yet. Worse than that, I think we need to work together. And I don't think we have achieved that as yet. Thanks to ISDR, we've been able to try to regroup the forces. But we cannot say that for the time being we have the same type of coordination in prevention, in preparedness, in disaster risk reduction that we have had so far in the response of humanitarian action. Thank you very much.